Okay, so I'm going to check the patient charts to make sure I have the right patient in the right room. I'm going to make sure I have all the right equipment, which is my stethoscope and my pen light. I'm going to enter the room. I'm going to allow for patient privacy. Hi, my name is Brandy. I'm going to be your nurse today. I'm going to report hand hygiene. All right, so I'm going to be doing a full systems assessment on you today. Can I get your name and date of birth? All right. Thank you, Mrs. Green. So what are you here for today? Awesome. Do you know what the date is? Okay, are there any allergies I should be aware of? Okay, amoxicillin and latex, so I'll make sure not to use latex gloves. Are there any medical conditions I should be aware of? All right, thank you. So what did you do for Halloween this year? Awesome. Are you married? Oh, wonderful. When were you married? Aw, that's sweet. All right, so I'm going to start by inspecting the hair for any lesions or scars or dryness, and that looks good. I'm going to move down to the face. I'm going to inspect the skin. I'm going to feel it, and it feels warm. The face is symmetrical, as are the ears and the nose. I'm just going to take off these gloves here. I don't want to get... So now I'm going to check Perla. Awesome. And can I get you to follow my pen light here, Mrs. Green? Wonderful. Okay, now I'm just going to put on another pair of gloves. I'm going to inspect the nose and the eyes and the ears for any drainage or irritation. I'm gonna sit that down for a second. Okay. All right. So I'm just gonna peek in your ears here a minute, okay? Ears look good. There seems to be no drainage. Just gonna lean over here a second. That looks good. I'm gonna look in her nose. There's no drainage or irritation, and the septum is even. I'm gonna check your conjunctivi, okay? Those are pink and moist. I'm gonna check her mouth, which looks good. Open wide. Awesome, thank you. All right, Mrs. Green, can I have you stick out your tongue for me? Just straight out. Okay, awesome. Then can you move it to this side? And this side? Can you smile for me? And then can I get a frown? Awesome, thank you. Okay, now I'm going to move to her neck and I'm going to palpate her carotid. Oops, her carotids, not doing them at the same time. Do the next one. Okay, those are normal. I'm going to check turgor. And that's appropriate for age. All right, I'm just gonna look at your chest a second here, okay? I'm gonna try and keep patient privacy as much as possible. Okay, so I'm inspecting the chest, hair in all the right places. There seems to be an area of redness with no exudate under the right breast tissue. And I'm gonna put on gloves to check for blanching. I'm just gonna put it on my hand here. And there is blanching, so that just needs to be cleaned up. Okay, so I'm gonna inspect the size. That looks good. It feels warm. Okay, I'm gonna listen to some breathing now, okay? And go for one full breath cycle on each side. I'm going to move down to the sides here. Listen on each side. All right, sounds good. Now I'm going to listen to some heart sounds. at this time, I'm going to match it with her radial pulse. That looks good. All right. All right, I'm gonna lift you up a second and I'm gonna listen to some breath sounds on your back, okay? I'm gonna lift her up while I'm here. I'm going to inspect the back. I'm noticing two what look like moles. You have these two bumps on your back. Have you always had those? Okay, her back is warm, hair in all the right places. Spine is symmetrical. Okay, I'm gonna listen to some breath sounds now. Go for a full breath cycle in each spot. Just gonna listen over here real quick. Awesome. Breath sounds were normal in all lobes. Okay, now I'm going to, is it percuss the kidneys? I think it is. So tell me if this hurts you, okay? Did that hurt? No? Okay. I'm going to do the other side here. You feel any pain? Okay, wonderful. I'm going to get her laid back down. All right, now I'm going to inspect your abdominal area, okay, and listen to some bowel sounds. So I'm going to allow patient privacy. Okay, I'm noticing that there is what looks like a patch here, and she has a history of diverticulitis. So I'm just gonna do this. All right, I'm gonna listen to some bowel sounds, okay? Start in the right lower quadrant. Sounds active. Now I'm going to palpate for any hernias or the pain. Do you feel any pain when I press down? No? Okay. Avoiding her patch. Okay, can I have you just lift your head up off the pillow? Kind of like bear down and flex your stomach. Does anything hurt? I'm noticing that there's no hernias when she does that. All right, you can lay back down. I'm going to allow you as much privacy, but I have to check your perineal area, okay? I'm going to don gloves for this. All right. So I'm going to inspect and pull apart the labia. There seems to be an area of redness and inflammation, but there's no drainage. Does anything feel uncomfortable down here, Mrs. Green? Okay. So I'm gonna pull her gown back down. Dispose of my gloves. All right, now I'm gonna move to your legs, okay? Dispose your feet here. All right. Does any of that hurt? Okay. Muscle tone seems good. What about your joints? Does it hurt when I press on your joints? No? Okay. So I'm going to check cap refill bilaterally. All right, it's less than 2. I'm gonna palpate the pedal pulse. And that seems to be +1 bilaterally. All right, can you press against my feet or my hands? All right, now pull against my hands. Awesome. All right, so legs look good, skin is normal and warm. Feet are clean, nails look good. And the bottom of the feet look good, they're not too dry. All right, I'll cover you back up. Now I'm going to move up to the arms here. I'm going to inspect them. All right, it looks like she's got some kind of bandage on her arm here. Where'd you get this bandage from? Oh, okay. I'm noticing that her skin is warm and normal. Muscle tone is good. Does it hurt when I squeeze any of your joints here? Not even your shoulders? Okay. I'm gonna get your other arm here. Okay. Muscle tone seems good. Does it hurt when I press on any of these joints? Okay. I'm going to check capillary refill. Okay, -2. All right, can you go ahead and squeeze my hands as hard as you possibly can? All right, grip strength is strong bilaterally. All right, now I'm going to turn you over so I can inspect your buttocks, okay? Okay, so I'm gonna allow as much patient privacy as possible. I'm gonna help her over. Oh boy. Okay. I'm going to keep as much patient privacy as possible. You just lay there for a second for me? Okay. I'm gonna don gloves so I keep the patient safe. This will just take me a minute here, Mrs. Green. Maybe. There we go. Okay. So I'm going to inspect, and she has a 2-inch skin tear that has been covered by pteroderm. She looks like she's got a little bit of redness here. All right, with induration. Okay, going to pull apart the gluteal folds and inspect. Gonna feel if it's warm, look for any redness or irritation, and besides that spot in the skin tear, it looks good. All right, I'm gonna palpate those hip joints. All right, and it looks good. I'm just gonna pull you back over here. All right, there we go. All right, everything looks good. I'm gonna cover her back up. All right, is there anything else I can do for you today, Mrs. Green? All right, everything looks good, so I'm gonna give you your call light, and if you need anything, just let me know. Would you like your bed sitting up or down? Here is fine? Okay. Let's make sure this pillow is situated and that feels good for you. All right, thank you so much. Perform hand hygiene. Leave the bed in lowest position I gave her the call light. And now I'm going to go document and leave the room, allow for patient privacy, and